Teresa. Are they running on time?
As far as I know, they're running on schedule.
Oh, good.
Hey, I hear you're going to college.
Hey, college girl.
Hey, Dr. Wright.
Hey, Mrs. Bloom. I'm so glad you could make it here also. You must be very proud that your daughter's going off to college now.
Yes, I am. I'm very proud, and thank you so much for considering my schedule when you made this appointment.
Oh, no problem. So, Teresa, I know you're doing well right now, but we scheduled this appointment to update your transition plan that we developed when you were 16. Now we want to make sure that your health care plan is set for next year to assure success in college. Since you will be in state, we can revise this plan as we need to, but keep in mind that a lot of your support system's not going in your suitcase. So we want to make sure that you're feeling informed and confident. Okay? So fill me in on some of your thoughts since completing the questionnaire I sent you.
Okay. Well, I've been thinking about your offer to keep you as my PCP, but I feel like this is a natural time for me to transition onto an adult doctor around campus.
Well, I have to say, it would be my preference that the two of you would stay together. It makes sense that she would stay in this practice and she can be on her insurance till she's 26.
Mom, I know that, but I can find a doctor in College Town. I mean, I'm over 18, I'm my own guardian, and I'm really ready to go to a place where there's no Legos in the waiting room. No offense, Doc.
None taken. I agree with you. You've taken a lot of time to think through this. Even though you may stay on your parents' plan until you're 26, it doesn't mean that you have to rely on them for all the decision making. And I think finding a PCP in College Town is a good first step. In fact, I think I can give you some referrals in that area if that's what you'd like. I think another good compromise would be for you to establish a relationship with a doctor in College Town, but keep your specialists here in your hometown. And then I'll continue to stay on your medical home team, and I can consult with your new PCP once you find one.
Yes, that sounds perfect.
Dr. Wright, if you stay as her consultant, I'm totally fine with that. I mean, that's why I wanted to be here at this appointment, just to see how you guys related and how we're just going to move forward.
Okay, Mom. I've got this.
Thank you so much for coming, Mrs.
Oh, thanks for having me. Okay,
Bye,
I'll see you
Mom.
later.
Bye.
Okay, Teresa, let's talk about your personal goals. We'll outline a couple of these, and then your healthcare goals will fall underneath that.
Okay. Well, my first goal is to make new friends and fit in. Second, I want to do okay getting around campus. Classes are farther apart, and with more homework, I'm concerned about getting worn out. I don't want to get to finals week and have nothing left. My third goal is to study with my class next year abroad. And what?
Wow, I mean, way to use the goal worksheet that I sent you. I'm pretty impressed. You've got a clear short-term goal, a mid-year goal, and a long-term goal. Now, in order for us to make these goals happen, we've got to keep you healthy. So that's why we need to continue to update your healthcare transition plan to guide you and your new PCP. So let's talk about some specifics. Okay, number one, you said you wanted to make some new friends. I don't think that's going to be a problem for you. But Teresa, I know this may be difficult to talk about, but we have to discuss your sexual health and overall safety. Maybe finding a GYN in College Town where you can discuss contraception would be wise.
Geez, Doc, nothing like getting right to the point. I mean, I appreciate you waiting until my mom left, but hello, this is still a little bit awkward for me. For now, trust me, I'll ask my friends for some recommendations in College Town, and I'll get back to you on that.
Fair enough. Now, as far as staying healthy and not getting run down, I've got a few ideas, and I'll gather these together and send home with you. Some tips on nutrition, sleep hygiene, exercise, stress management. Now, for goal number 3 in studying abroad, with a little extra planning, I don't see why you can't travel abroad like anyone else. Your vaccinations were updated when you started high school because of our earlier transition plan, but there are some special vaccinations that you'll need for traveling in a foreign country. So let's pull some of that together when you come home during the holiday break.
Okay.
All right. Now, for anyone transitioning to college, we need to have an easy-to-read, one-page summary of their health condition. This should have medications, allergies, key diagnosis information, surgeries, contact information for all the members of the team. So it should also include an emergency plan with some explicit instructions for prepared actions to be taken during any urgent events. So I'll type one of those up, and it's a good idea for you to keep an electronic copy on your iPad or even a flash drive. And this can be helpful for your new PCP and any other new providers.
Yeah, so I think I'm going to give my copy of my emergency plan to my roommate, my RA, and the Student Health Center.
Great. By the way, your specialists will need to be updated too, so I'll schedule a conference call so that we can update your care plan and let them know to expect a new PCP in the upcoming months.
Thanks, Doc. That would be a huge help, and it would also make my mom and dad feel better too.
Good. Well, this has been great to make these decisions together. Is there anything else you want to talk about?
No, I feel good. I feel really confident.
Okay, so if you'll hang on a minute, I'll go get those tip sheets we talked about.
Okay. Hey, I just finished up my doctor's appointment. My doctor is freaking awesome. You know, I think I'm gonna actually send him a tweet right now. Okay, later.
If you are a patient, come prepared to your healthcare transition appointment. Demonstrate to your medical home team that you value shared decision-making. Follow up with your healthcare provider regarding critical next steps to assure adequate transfer of information. If you are a family member, empower your child to be a wise healthcare consumer. Understand that healthcare transition is a lengthy process, so start early with small steps that support independence. Discuss with your child how decisions will be made regarding health and wellness. If you are a provider, be proactive. Set up a healthcare transition appointment. Honor the cultural norms and family dynamics of your patients. Check in with the patient themselves to be sure they are informed and confident following the transfer of care. For additional tools, resources, and information about youth healthcare transition, visit us at www.gottransition.org.